Kansas doctors fighting to save American lives are asking your help in the fight to stay in America. And a plea for more help in communities the coronavirus has hit the hardest. Plus, we know the economy took a dive, but will reopening really allow it to soar again? That's what we're talking about right now on Kansas Week.
Southwest National Bank has proudly served Wichita and its surrounding communities for over 100 years. We are happy to support KPTS, Public Television for Kansas.
Continuing coverage of the COVID-19 pandemic in Kansas is funded in part by a grant from the Facebook Journalism Project Community Network Grant Program, run in partnership with the Linfest Institute for Journalism and the Local Media Association.
Pedraza, and this is Kansas Week. In the last week, the state of Kansas has begun to reopen, at least some businesses finally getting to unlock their doors again. But we've still got a long way to go, and a lot of questions about the coronavirus remain unanswered. What's for sure is the damage this pandemic has done will take a while to fix, especially when it comes to Kansans' financial futures. KAKE's Greg Miller explains.
In a report filled with news of double-digit losses, there is some good news from WSU's Center for Economic Development and Business Research.
Takeaway here is, although we're going to have this big decline, we do think that there's going to be somewhat of a rebound of it. Right? That doesn't mean we're going to get all the way back where we were in January.
Jeremy Hill commissioned the report, which shows a 10.2% decline in employment statewide this year compared to last. Wichita will likely be hit the hardest with a decline of 14%, thanks in part to the Boeing production freeze. The losses are happening now, but a rebound could come as early as this summer.
In Texas, we're going to gain back about half of the jobs that we've lost in the first part of this year.
So what isn't coming back? He says retail sales, because of a bigger shift than ever to online buying, larger retail chains are suffering. And as more of us work remotely, there's the question of what existing jobs will look like after the virus. Meanwhile, service jobs, waitresses, bartenders, some of those have already come back. Others may too within a few weeks. But if you're still unemployed, what are the skills you need now to find your next position?
Scientific software, critical thinking, complex problem solving, database management, communication, remote work environment, and written comprehension are all those premium skills and abilities going forward.
And creativity. Hill says now is the time for new ideas to stand out as the marketplace rapidly changes.
I think that'll make us competitive, particularly in the Wichita market. I want the entrepreneurs here to be more creative here than somewhere else.
And we have an unusual panel this week, separated by time and distance. In a little bit, we'll speak with Kansas Lieutenant Governor Lynn Rogers. But we start with Kansas Congressman from the 1st District, Dr. Roger Marshall, with us by Skype today. Thank you so much for joining us.
Glad to be here. A beautiful day in Kansas.
Very much so. Now, the situation in Kansas is hardly unique. Nationwide, we've got about a 14.7% unemployment rate, the highest since the Great Depression. The CARES Act has helped some. Many see it as a drop in the bucket. What's next? Another round of stimulus packages?
Well, Father, I think what's next is getting people back to work. We need to get Kansans back to work and make sure we do that in a safe, responsible fashion. And I'm excited. All over the week, I've been talking to doctor's office and hospitals that are back to work now, optometrists as well. So many professions getting back to work. There's not enough paper to print enough money on in D.C. to fix this problem if we don't get Kansans back to work. And the other problem I think that I'm really concerned about is just the emotional scars that we have on people right now. Those that have taken care of sick patients, but just economically, the scars throughout the state as well. And we have to make sure that we're reaching out to our fellow neighbor and doing what we can to lift their spirits as well.
Hey, I know a lot of folks really interested in going back to work, but there are also those who, for whatever reason, either they have family members or they personally have health issues, are afraid to go back to work, and yet they've been told that there's no protection. Is there some way that Congress can protect those who shouldn't be going out?
Well, I think that we have done quite a bit of legislation, and even the Paycheck Protection Program, I think, was to set up to help those people that who couldn't go back to work either. And then of course there's a big unemployment insurance as well. So I think we're done quite a bit already, but if we need to do more, we will.
Well, what I'm talking about is there are communities, I know there's at least one story out of Kansas City of this happening, where the community is reopening and companies, businesses are reopening, but folks who want to go to work or want to stay home because of health issues are being told if they don't go to work, they're not going to qualify for unemployment anymore.
Well, that's news to me, and we'll have to look into it. But I certainly understand the situation, and I certainly agree that if you have an underlying medical condition or you're over the age of 65, that I don't know it's quite time for that person to go back to work. It would kind of depend on the situation, but that's something I'll want to look into yet because we may have missed a few people.
And you talked a lot about unemployment. Giving Tuesday was this last week. A lot of charities spoke about increasing need and decreasing donations. Is there room to go back to, say, Great Depression projects like the WPPA, the CCC, where the federal government provided some jobs for those who couldn't find them anywhere else? Because this new report from Wichita State says a lot of these jobs are not coming back.
Well, I think that we all need to take a breath here and see where we are even in 2 weeks or 4 weeks. I really think over the next month or 6 weeks, a lot of those jobs are coming back. We're paying people anyway through June the 30th. So the Paycheck Protection Program allows those small businesses to keep open. We've increased the unemployment insurance, gave people an extra $600 per week. But I would rather look at an infrastructure plan, something like that, and in the way the work projects from the 1930s may be today's modern infrastructure plan. So we'll see where we are in June and July.
Well, talking about infrastructure, a lot of folks here in Kansas looking for some of those call operator jobs at the Department of Labor to help with the unemployment that has been just completely overwhelmed with all of the calls they've got coming in. And I know that there have been a lot of complaints from states like Kansas that when it came to the special unemployment offerings, the additional $600 a week, the money for self-employed Americans, that the federal government made promises that seemed like that money would be coming immediately, but didn't take into account the need to figure out the rules of the new programs, not to mention how to program it into already overwhelmed ancient computer systems. Was there any discussion on the Hill about how to help states with this infrastructure issue?
Well, I guess some states have handled it better than others. So the job of the federal government was we quickly moved, we gave them the money, they knew it was coming. So some states expect the federal government to fly in with a helicopter and fix all their problems. Other states have solved some of theirs as well. So I think the federal government did everything that they needed to do, and the state now needs to respond and do their job as well. The federal government cannot micromanage every little situation like this.
Well, we're going to move on to another topic here real quick. Many things to talk about. A report this last week showed that minority marginalized communities were paying a much heavier price for the COVID-19 pandemic, both financially and health-wise. As KSN's Alexis Padilla shows us, some minority leaders here in the Wichita area are asking for a redistribution of aid to help those who are hurting the most.
Our lives begin to end the moment we become silent to things that matter.
Now Wichita community groups are creating a coalition to speak up.
For many, many, many years, we have been neglected in the African American Northeast community of the city of Wichita.
Data has shown across the country coronavirus has disproportionately impacted the African American community.
We may be the least of the population, but are we the most of the virus?
The coalition sent a letter to city, county, and state officials, voicing concerns and action they want to see.
I want my community to be tested. That's what we want, is to make sure that they understand that it's there. And then, of course, we do want to see the data. We do want to know exactly what's going on and where it's going on and how we can help.
As Kansas begins to reopen, the coalition says now is the perfect time to take action.
If you listen to all the experts, the second round could be far worse. So you be proactive. We need to do something.
Alexis Padilla, KSN News 3.
And as Alexis pointed out, this is not a Sedgwick County or a Kansas issue. This is truly across the nation, where we're seeing African-American communities having about 2 times the chance of catching COVID-19 as those in the general community. Is there ways that the federal government can make sure that aid is funneled to the communities that need it the most?
Absolutely, and I think we're doing those things already. So I think about the food banks and the extra money for SNAP dollars already, $3 billion of extra money for the food banks, making sure that gets to the people who know the best. So those local communities typically know the needs the best. Then there's something called a federally qualified health clinic. There's 18 of them across the state of Kansas, and they give discounted health care and also COVID testing. So there's millions of dollars given to each one of those clinics trying to reach out. And then this last round of Paycheck Protection Program, we really tried to target smaller businesses. And though the first round, the average loan, I think, was over $200,000, this loan, the average loan this time, I think, was in the $80,000 range. So absolutely, we're trying to reach out to make sure every American gets the help that they need.
Now, how can the federal government get in there to work to make sure that, it's talking about the small businesses, the money is getting to communities that need it the most? One of the complaints that these community leaders had is that because so many minority businesses do not have relationships with banks, they weren't able to get their hands on those PPP and emergency disaster loans from the SBA.
Right. Well, I can tell you what our office did is that we proactively reached out to some of the minority chambers and the banks in those areas to see what can we do to help connect them as well, to make sure that they were involved in the process. And the second round of Paycheck Protection was specifically targeted more for small banks and communities to give them that opportunity as well. So I think we've done those things. But again, it's so hard for the federal government to micromanage this, that it takes some proactive help as well. So we've added extra money to it, and there's still money left. So I really think that most everybody should have had a fair shot at it by now.
Well, as doctors in Kansas and across the nation are struggling to fight the virus, some are in a fight of their own to stay in the country here in Kansas permanently. A doctor from Canada working in New York announced on Instagram that immigration had denied her an employment-based green card, saying she didn't meet the qualifications of being a person with advanced degrees or exceptional ability. She's appealing that decision, even as some doctors in Kansas are fighting to get the federal government to jump immigrant healthcare workers to the front of the line for green cards, as I showed in this report on Cake News. Dr. Akshat Kamat sees Liberal as his home.
I intend to stay here for the long term.
He's one of thousands of immigrants in the United States providing badly needed medical care in the middle of the pandemic. As a member of Physicians for American Healthcare Access, he's asking his congressmen and senators to pay those immigrants back for their life-giving work by moving them to the front of the line for green cards.
I have about 6 patients on the ventilator.
Like many, he's here on an H-1B visa. His family can only stay here as long as he can work. If he catches the virus and is permanently disabled or dies, they have to leave the country.
My 3-year-old daughter, she was born here. She does not know life beyond the U.S.
According to the U.S. Immigration Service, there are about 12,000 healthcare workers across the country in the same situation as Dr. Kamath. Here in Kansas, that's about 300, mostly in areas that struggle to attract and keep medical workers. Meanwhile, the Washington think tank the Cato Institute says there's a backlog of more than 1 million green card applications, with Indians like Dr. Kamat making up 75% of them, leading to a decades-long wait without help.
I feel that all of us deserve to be, not discriminated against and to be taken care of and have the safety net for our families.
Kamat is asking Kansas's congressional delegation to support the recently introduced Healthcare Workforce Resilience Act, making it easier for those saving lives to stay in the country. And Dr. Marshall, where does this stand? Is there a chance of this legislation ending up in the next stimulus package or being passed this year, presuming there is another stimulus package?
Well, it sure was. It was an honor to work with Dr. Kamath there in Liberal at the Southwest Medical Center. He's an incredible physician, caring and compassionate, and was doing a great job as well. It's really hard to fix a very broken complex immigration system in the middle of a crisis. I don't think that this is the right time to try to fix it. I think that right now our focus has to be on keeping Kansans safe and healthy and trying to get this economy going again. I understand there's multiple problems broken in the immigration system, but it feels like, you push on one part of it and then it gives out in another. We need a complete overhaul, a complete fix to a very broken immigration system. And until we secure the border, fixing that immigration system just doesn't seem to work no matter which way or which rabbit hole you go down. So we have to secure the border first, and then we can fix a broken immigration system.
But couldn't it be argued that being in the middle of a pandemic, we need healthcare workers the most? According to Southwest Medical Center, 1/6 of American doctors are foreign born. That's a lot of doctors that we need right now.
Yeah, I understand your point. The good news is the virus is on its way down. I do think we have enough healthcare workers. That is, we're not going to have nearly as many cases as folks were talking about. Probably more concerned about respiratory therapists and the number of nurses we have. I understand some communities isolated problems with physicians, but we're going to get through this okay.
All right. And anything we haven't talked about that you think we should have brought up today?
Well, I still think the most important thing to talk about right now is how do we safely and responsibly get Kansas back open for business again, and at the same time healing these emotional scars out there. The stories I'm hearing from people are very, very concerning. 5th, 6th generation farmers, ranchers that could be losing everything that they have because of the COVID virus. The biggest challenge economically in Kansas, and it's hard to say the biggest, but down in southwest Kansas right now is keeping the packing plants open. That since they're operating at decreased capacity, it's causing a huge strain on the local economy because we're not unable to get the cattle into that processing plant. We process 25% of America's beef there, so it's also going to have a complex breakdown on the supply chains all across America. So my focus right now is how do we safely keep those packing plants open, and how do we safely reopen Kansas? And I just want to stress the worst days are behind us. The sun's coming up in Kansas. We're going to make it.
All right. Thank you very much, Congressman Marshall, for joining us today. I look forward to hearing from you again soon. State leaders are also working on a lot of these topics, especially when it comes to our economy. Before the show, I was able to catch up with Kansas Lieutenant Governor Lynn Rogers and asked him about many of these same topics. So, Lieutenant Governor Lynn Rogers, thank you so much for joining us from Topeka this week.
Thank you for having me.
So we're going to start off with, this has been a big week in Kansas, major change again. It's been a year of major changes, but a major change again this week as we started the reopening process. From your perspective, as you're watching what's going on, how are things going? Are they differing quite a bit from county to county?
Well, some counties have been a little bit more restrictive. They've made some adjustments to the plan, which is part of the process. We wanted to make sure that we started transferring responsibility to those counties, and we think that's a good step. People are being careful, and I think they're making sure of what's best for them, which I think is very, very helpful. People are still concerned about themselves and their neighbors.
I've certainly spoken to a lot of people saying I'm happy to be out, but I'm wearing masks, or I'm staying 6 feet away from folks because I'm still concerned about safety. I don't want to get sick.
Exactly.
And that's going to be an issue for quite some time yet. A new report out from WSU Economics Business Department looking at the employment future for Kansas, and it's not exactly bright and shiny. Looking at keeping a lot of the losses that we've had over the last couple of months. What are things that the state is considering at this point moving forward?
Well, we have our Department of Commerce working on all kinds of different options. We'll have some grant money that will be coming out from the feds under the CARES Act. The governor has just appointed the Recovery Office Executive Director, and the board chair will be putting a team together to help them on that, to help get the money from the federal government out to the different counties and the cities. Some of that will be reimbursement for what they have already spent. It can't be used to fill revenue holes, but we'll be following the federal guidance on that. You'll start hearing stuff really next week in that regard. And then, we're continuing to meet with different chambers of commerce, with different organizations. It continues to be all hands on deck, doing whatever we can to not only get our economy moving again, but making sure that we're safe in the meantime.
And you talked about a lot of that money can't be used to fill revenue holes, but we know there's some pretty big revenue holes coming down the pike here. And the governor has spoken about trying to push for more federal legislation that would get some federal aid here that could be used for some of those things, like we saw with the Great Recession. How's that push going at this point?
Well, we haven't gotten there yet. Part of that is Washington's not working on full business yet. I think we've had a good response from our legislators. I think we need to continue to hold their feet to the fire to help us in that regard. Similar to what was done in the Great Recession of 2008, 2009. It's going to be really key. It's really going to be vital. We're also looking at things that we need and can be cutting. None of them will be helpful to the economy to bring us back, but it's what we need to do because we have to have a balanced budget by the end of the year.
So any ideas yet on where those cuts are going to be? Because I know there's been a lot of talk. Will it be here? Will it be there? Education, healthcare. I mean, those are some of the biggest budget.
Yeah, I think, the governor, when she submitted her budget, was very careful. We tried to make sure that we didn't expand any more than we had to. My guess is that some of the things that were expansions in the last year or so will be the first items that we'll look at. We're going to do everything we can to stay away from education. There is some federal CARES Act money that will go to some of the schools to help backfill some of their budgets. But we're kind of looking at all the different options right now, knowing that in the end, we're probably going to need to have some legislative input. There's some things there. We don't have a big cushion, as you know, with what we've been through. Fortunately, our revenues were repaired somewhat with the overturn of the Brownback tax plan, but there's still a lot of work to be done.
How are things going? I'm going to pivot a little bit to the healthcare aspect. Last week, Governor announced we're getting, we have an order for 500,000 testing kits, getting them at a rate of about 10,000 a week or so. Are those coming in on time? Are we getting those? How's that going?
From what I've heard from our Secretary Norman and KDHEs, they are. We're starting to see, and you're seeing that in some of the test results. And I know people are kind of concerned that they see larger numbers of people testing positive, but in many cases, it's just indicative of the extra number of tests that we're running. And so I think we're happy with the amount there. We still need help with PPE. We have a lot on order. We're seeing a little bit of that. Some of it's going directly to the counties, even from FEMA, so we don't always know what they get. We have a lot of orders out for it that we're waiting for a response. We're hoping to get that in place before too long, too.
Now, one of the reasons why I brought up the testing was because this week we had minority community leaders, specifically the African American community here in Wichita, standing up and saying, listen, we have twice as much possibility of catching this illness, twice or more chance of dying from it. We should have more of the tests in our community being done with our folks. Has there been any discussion, do you know, of targeting tests to the communities that are more likely to be hit?
Well, we were the second state, I think, in the nation that started giving out the demographic information. And we saw very early that people of color are hit much harder with this virus than anyone else. So it has been a concern of ours from the very beginning. I know Dr. Norman has also been talking about with some of this additional testing to take it out into particular communities. So I hope we can do it. And I have long held concerns about the level of testing in Sedgwick County, and I think we need to do a lot more. Sedgwick County is one of two in the state that is getting money directly from the CARES Act, and so there is funding available for them. So I hope the Sedgwick County leaders take the concerns of the African American community seriously and make sure that we start testing. We did that in our meatpacking plants, and we've learned some things in terms of the number of people that are carrying the virus and didn't know it. That had symptoms weeks ago. And so I hope Sedgwick County does step that up. We're seeing it in a few other counties. Wyandotte, Johnson are looking at those communities very seriously, and I think we need to make sure we take that serious everywhere.
So as we move forward, you had mentioned some concerns about the testing here in Sedgwick County. I know that there are folks in some of the smaller counties that are worried that they're just not seeing testing being done there at all. I know we're getting help with testing out in Southwest Kansas. What does it take to get to that widespread population level testing that Dr. Norman has been saying we need to do to really be able to reopen?
Well, I think it's been this latest 50,000 chunk of tests that we got. We've been sending those out to all the different counties. Every county, even if they don't have COVID cases yet, and we have 82 of our 105 counties that have had a case, even the other counties still need to be testing, and so they're starting to get them. They won't do as much, but they still need to do so many per 100,000 of residents. And so so that we have the health metrics that we need so we can know if we need to move and can move to phase 2 of the recovery plan.
So at this point, we're 1 week through phase 1. How are things looking for moving to phase 2 right now? Obviously, I know they can change.
Well, we haven't looked at, they look at numbers daily, but the governor will have a report from Secretary Norman early next week where they'll start talking about where they've been for the last 10 days, and we'll continue to watch that. They're keeping tabs daily, and again, I think as he mentioned, sometimes the numbers come in from the different counties a couple days worth at a time, and so a single day can't be viewed as indicative, but the trend lines, and he's been, I think, I don't want to put words in his mouth, but I think he's been happy with how it has revealed the modeling. It's been very close to what they've modeled. So I think that will help us move. And the governor's also said too, and in the past with other things, is before we move to that next phase, to make sure that we give counties and folks enough information in advance so they can prepare to either move forward or we stay where we're at for another week.
All right. Well, we'll definitely keep checking in with you guys as this situation continues. Thank you so much for joining us today.
Thank you.
Do you have questions or concerns about the pandemic that we haven't discussed today? We'd love to hear your ideas. Email us at kansasweek@kpts.org. For now, stay safe and have a great week.
Southwest National Bank has proudly served Wichita and its surrounding communities for over 100 years. We are happy to support KPTS, Public Television for Kansas.
Continuing coverage of the COVID-19 pandemic in Kansas is funded in part by a grant from the Facebook Journalism Project Community Network Grant Program, run in partnership with the Linfest Institute for Journalism and the Local Media Association.